Good afternoon. My name is David Knox, April 18th, 2024, and I have multiple system atrophy, MSA. I have discovered the happiest, most beneficial, longest lasting item when it comes to healthcare for MSA. It hit me so hard today that I said, I've got to come home because everything comes full circle with a terminal disease. You see things that you've never seen before. And the word for this is interdisciplinary care. 2 words. Interdisciplinary care. We hear that it's going to take a team effort to help you, to help me, in this case, with MSA. We go out seeking all these doctors and treatments, diagnostics, right? Office visits, MRIs, DAT scans, PET scans, everything. And excuse my French, kids, shit rolls downhill. And unfortunately, this is what happens in the medical field too. So when you find the institution that does it and does it well, what a burden it is to be off of your shoulders because you are now in great care. There's really 3 types of institutions I'm talking about here. Number 1 is the plain old office visit, like me going to my neurologist. Number 2 are higher end, well-known research hospitals like the Mayo Clinic, the Cleveland Clinic, things like that. And number 3 would be academic hospitals. In this case, I'm going to talk about IU Health, or Indiana University Health. It's IU, Indiana University Academics College, that is a juggernaut. Now, what's really the difference between the 3? Well, obviously your local office visit, my local neurologist, is contained. Not much funding to do things. They just see you, notate things, and send you for tests. Right? And treatment from there based on really one person, and or the diagnostics from the other doctors, reading radiographs, x-rays, MRIs, things like that. The other one, like Mayo Clinic and Cleveland Clinic, are not really academics. Lots of donations, lots of money. They do very well, lots of research. But there's not much to do with academics at that point. Yeah, I know research is academic itself, right? It sounds kind of weird. But it's not attached to any like college or any learning institution, properly said. Academic colleges that have medical facilities have the best of both worlds. Not only do they get funding, private funding, government funding, but they also do it their own. They have their own funding because they're college, right? Tuition, they see patients, money. Which one's better? Well, it depends. Let me tell you about why interdisciplinary care is absolutely so important, especially right now as I'm speaking to you. My neurologist, local neurologist, really seems dismissive. Not that she doesn't believe me, but, these symptoms are, no, this can't have nothing to do with MSA. That can't happen because of MSA, because she doesn't, he in this case, she doesn't know. She's not a movement disorder specialist. Do I fault her for saying these things? No, but I fault her for saying these things that she does not know. So, when I went to the Mayo Clinic, it's a one-stop shop for the most part. You go there for a few days, tops, whatever, and you get all your testing done for the most part. If things are really booked out, you got to wait and come back. But for the most part, things are done on the spot. Really nice. And the Mayo Clinic, not to talk crap about them, they work together too. Quickly, they share records and they collaborate. That's really the key word. My doctor, my movement disorder specialist in Indianapolis, the one who originally diagnosed me, one of the 4 at this point, who diagnosed me, she said, "Hey, here's MSA. I'm going to take a step back and let your local neurologist, treat the symptoms. But she says, whenever you want to, you can contact me and we'll help you. My office is your office. Great. Well, I started getting bad vibes from my local neurologist for a while because she just doesn't know about MSA, even though her mother had it. She just doesn't know. She doesn't know what to look forward to, what to see. Look around the curve and get ahead of some things if you can. So I go back to my MDS, my movement disorder specialist in IU Health, a couple months ago. And I said, I'm having these issues with swallowing and breathing. Didn't say anything else. I get there, and I have a breathing test waiting for me automatically. I didn't know about it. I didn't ask for it. Waiting for me. Proactive. That's awesome, right? I get the test done, and literally she says, good, bad. And now we got to get referred out because it's not Mayo. Don't really get things all done at once, but let me refer you out to this ENT specialist. I get to my ENT specialist yesterday, and the ENT have no idea what's going to happen. I get there, there's another tracheotomy or trachea scope waiting for me. Weird, but on the fly. I'm like, oh, okay, well, I'm happy you're doing tests, right? That's bad because they're doing tests, but good because they're looking for things, being proactive. And she says, vocal cord dysfunction, which I'll talk about in the video probably tomorrow, Friday. And this other part of breathing and swallowing, not good. So she says, I want you to see not a speech specialist, but a swallowing, a specialist for voice. I can't remember the word, forgive me right now, but I'll get it for you in the next video, much more detailed. Who I saw this morning. Another trip back to IU Health, 2.5, 3 hour drive. I see here we talk for an hour. We not 5 minutes in the doctor's office, not 15 like the other neurologists. 55 minutes. 50 minutes. Talking. Yes, no, this, that, what happens here, what happens there, does it happen when you do this, does it happen when you do that, does this trigger it, does this not trigger it, right? Very good back and forth. And she says, I'm going to help you with this, but I'm concerned about this, which is not my specialty. Let me get you set up with a swallowing, forgive me doctors, swallowing doctor and specialist, right? Which I've already got the appointments for. Quickly, in the next few days. What I'm trying to say is these IU health doctors, university health doctors, all work together. They all look at each other's readings, and they not only do they see issues, but when they see issues, they send you in the right direction. It's different because they've already read your charts when you walk. How many times have you gone to the doctor and say, "What are you here for? Don't you have the damn referral? Don't you have my medical records?" Mayo Clinic did that, and so did IU Health. They did that too. My local neurologists and PCPs and other doctors, no. Because crap rolls downhill. We don't need doctors that we have to beg to do things, to look for things, to ask for. A local, even in my case, it's not local. I don't have a local MDS. I got to go 3 hours for my movement disorder specialist. Gas and time and food, right? It takes time. Resources. But they know things that these other doctors don't know. They know when these things might start, how they're starting, based on my prior medical records. I should check on this, I should redo these tests, redo those tests. And how nice, how comforting. I left this hospital today smiling with my daughter. And I told her, I said, I can't go back to my regular neurologist. I'm asking questions I shouldn't have to ask. What do you suggest we do? Is there anything? No. Should I repeat any tests? No. Like, well, we can do blood work. Oh, that's okay. That's fine too. But no. My movement disorder specialists have ordered literally 10 tests, and without you, proactively, they have found out that not only do I have the vocal cord dysfunction, which is damn near close to stridor at this point, which is death for MSA, but now I have separate issues of swallowing with I have tonsil issues, I have the esophagus issues, I have spasms, and I have respiratory issues, lung issues. That's what the lady today said. She said, I'm concerned that your breathing is so labored and erratic that the MSA is in the respiratory issues right now. So we went from nothing in IU Health to just a few weeks to everybody's on the same page and saying, yeah, I got this, they got that, they got this, and we're all working together, and they're still directing me to places I need to go. Can you imagine if I'm sitting here waiting on my local neurologist to find this? And I know I might be being a bit of a butthead right now and complaining, but I don't complain. I don't like complaining to doctors. It's a terminal disease. We know it's going to affect autonomic and all these other issues. Do I need to start looking for a wheelchair, hospice care, ambulatory? I mean, what do I need? What should I start looking into? These couple of neurologists I had before don't say anything about that. But thank you, IU Health. Thank you for being on the same page as every other doctor in this facility. It's amazing that not only they caught one issue, but in totality, there's 4 separate issues right now that require 4 separate specialists for everything here. Wonder why I'm tired? You wonder why I about stroked out last night? The whole face is now in pain and tingling. I mean, there's lots of reasons. I'm not saying that it was necessarily a stroke. God, it felt like it. I can promise you that. Wife's begging me to go to the hospital. But it's nice to have true interdisciplinary care where they all work together and they check on you. They check on the other records and see who's doing what and who's recommending what. It's nice. It's what's needed. I see so many comments in forums and pages, Facebook, Reddit, Instagram, you name it, who cares? I see so many where people are struggling. And I promise you, if you can put 2 feet in front of the other or have someone to push you, to help you in a wheelchair or whatever, get yourself to either an academic hospital or something like Mayo Clinic or like Cleveland Clinic, something like that. Yes, some of us might have great neurologists who do great jobs and can't ask for anything better. But the issues we're having should not be a surprise to where I'm getting so bad I got to walk into my doctor and say, hey, for the 5th time or 10th time, here's an issue. Can you help me with it? It shouldn't be that way. Doctors, in my humble opinion, which most of them are, should be ahead of the curve. We know how MSA progresses. So every once in a while, we need to check for this and this and this. My neurologist, not my PCP, my neurologist takes the same information from my first visit, eyes, pupils, breathing, tremor, same thing, copies and pastes every damn visit. So nothing changes. I'm still the same. But these other movement disorder specialists with this interdisciplinary care, all these other specialists in the other fields, hey, is that breathing normal? Is this what you always do? How's swallowing for food? How's your spasms? Does it happen at night? Is it like, they ask these probing questions because they look at you and notice. I act the same way with these doctors that I do with my neurologists because I'm hoping for the best. I'm not just making one up for one doctor and making something up for the other. Who does that? But to all my friends and family and followers, and especially those with MSA, like this for sure, you have to have a real team behind you. I am yes, I'm dying, but I'm the happiest dying person right now because I have a team of doctors behind me that are working together and using their tools to figure things out. Some things are quick, some things are not. This doctor says, well, you had a barium swallow test, but you need a modified test. We're looking here, from here down to your stomach, but we need to look shorter. We need to look from here to here for some of these issues, because the other test is not going to do it for them, right? Hospitals and they have different types of quality of equipment, different types of quality of imaging, right? So it's natural to have your own stuff, but they should be probing and asking questions and reading other people's notations and clinical notes and findings about you. There's so much distress I read online, and I promise you almost all of it is because there is not a team behind you that's actually helping you. How much easier it is to have a team that already knows what's going to happen to you, is ahead of you, and is preparing for what's going to happen next. Both a condition you have and a condition you don't have yet. It is important not only to your physical health, but to your mental health, because otherwise this MSA becomes hopeless. Now, when I went to Mayo Clinic, it was just a probing. It was a proving of symptoms. It wasn't really, the only interdisciplinary care they had was, let's test him for MSA by doing all these other tests. And then when things were found out, it was just specialists with medicine. Quite different to how IU Health is operating, which is probably different, but they're discovering new things are wrong that I'm not complaining about or didn't know so far. But yet they see the side effects of these things. You're able to carry on longer and stronger with MSA as long as you know you have the support you need. And then this applies to your family, your friends, as much as it does the medical community. I have friends and family, I have no doubt, that will always take care of me. I do not doubt that. I have no reason to doubt that. No matter how mean I might get one day, I know it will happen. No matter what I ask for will be done. But when you question, are your doctors doing the right thing, it's probably because you don't have a team, or you have the wrong team behind you. And I kept mentioning, there's a vast difference between Northwest Indiana and Indianapolis. Now, I don't know all things are the same, and I'm sure there's great doctors up here. I'm sure. But MSA requires a team of people to take care of this. Right? I have only seen Mayo and IU Health communicating between each other. All the documentation that has been sent to my local neurologist, all my tests from Mayo and IU Health in Detroit, all these, Beaumont, all these tests in doctor's reports sent to her, and all she does is read the findings to me. Let's give you medicine. And I've been complaining about this breathing, this choking thing for such a long time. This is not breathing, aspirating, four separate issues together, which I'll talk about in the next video. And what has she done? Let's give you a pill. That pill might fix the heartburn. It's not going to fix the four underlying failing parts of my esophagus area. Right? And that's the problem. We have to be able to have doctors that discern these things and dissect them and get to, if they don't know, get you to the right place. So, shorter video. Please, 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 I encourage you, especially if you have something like MSA or Parkinson's or PSP, dementia with Lewy bodies, essential tremor. If you don't feel you're getting the right help and treatments, you're probably not. And it's probably not you that's making this up. It's just you feel inadequate. You know, you're spinning your tires in the mud because doctors are not talking to each other, or you don't have doctors that are even talking. You have to get the team. It helps. Things go so much easier. When you walk into 4 or 5 straight visits to IU Health and they have random tests for you because they know how MSA progresses, don't we feel so comfortable and so happy, so at ease, so relieved that there are experts that know what's about to happen in the future and they're trying to get ahead of it as much as they can. Please, local neurologists are great, and if you have a great one, awesome. Get to at least an academic hospital, like a university for academics that have hospitals. They are so much better. The 3 hours is so much worth it for me to drive than going 15 minutes. It's so much worth it. I'm getting so much more care, so much more treatment, so much more knowledge and understanding, right? I'm this far away from Strider. Strider is the death sentence for MSA. I'm this far away. And yet the specialists at IU Health have said, we got options. We have options. We can do this, this, and this, which I'll talk about in my next video. My other doctors, nothing. This is how we live longer. And this is how we don't do stupid things to our own selves with a terminal disease. So, again, I want to thank IU Health from the bottom of my heart. And no, there's no conflict of interest. I'm not sponsored by IU Health. You know, I had my doubts going back down to Enoch, because I know what Methodist used to be down there, and I remember communities, a whole bunch of hospitals. Wow. I think now they are partnered with Riley Hospital for Children, where I took my oldest daughter when she was young. What a great facility Riley Hospital and IU Health is. Great. I like going into Mayo Clinic. Happy, smiles, facilitating, helping, enduring, great attitudes, everything. If you don't get this from your local doctor, you're missing out. And unfortunately, they're probably missing a lot of symptoms that you're not complaining about. So I'll see you. This is going to post today. I'll see you next video. Tomorrow, Friday, I'm trying to rest for these few days of traveling. It's taking a lot out of me. But I appreciate you. Love you to death. If you enjoyed the video, comments and likes, but definitely share it. Sharing is everything. That's what I care about more. And I will see you in the next video. See you soon.